All right, let's talk about something that hits home for a lot of us. If you're a man, say over 40, you've probably noticed it. That nagging joint pain, maybe your hair isn't what it used to be, or maybe you're just feeling a decline in performance you've been told is just, well, part of getting older. But what if that's not the whole story? What if the standard fixes are just masking a problem that could actually be reversed? We're about to look at a whole new way of thinking about this. So let's start with a story. This is Michael. He's 48, used to pitch in college, and now his shoulder just won't quit aching. He's done it all. The cortisone shots, living on ibuprofen, and now his doctor is talking about a major surgery. The kind with a 6 to 9 month recovery. He's feeling completely stuck between these temporary fixes that are barely working and this huge life-altering procedure. Does any of that sound familiar? Michael's situation really gets to the core of the issue. See, this isn't just about the number of candles on your birthday cake. What's really happening on a cellular level is that your body's incredible built-in repair system, the one that used to fix you up in a few days or weeks, it's basically stalled out. It's not broken, it's just stuck in neutral. And here's the problem. Most conventional medicine just doesn't know how to give it that jumpstart it needs. So let's dig into that for a second. Let's look at why these standard treatments so often feel like you're just slapping a Band-Aid on something that needs stitches. They're all about the symptoms, but they almost never fix the actual tissue that's been damaged. This right here shows the huge difference in philosophy. On the one hand, you've got conventional medicine. A lot of the time, its goal is to just manage your decline, mask the symptoms. And in some cases, with things like cortisone, it's what we call catabolic. It's actually breaking down your healthy tissue over time. But then, on the other hand, you have the regenerative approach. This is all about reversing damage, actually healing tissue, and being anabolic, meaning it's actively building you back up. Two completely different worlds. And here are the usual suspects, right? Those cortisone shots. We just use the word catabolic. Well, this is it in action. Each shot can actually weaken your tendons and cartilage. And ibuprofen, that's just hitting the mute button on your body's alarm system while the fire keeps burning. ED meds give you a temporary boost, sure, but they do absolutely nothing to fix the plumbing underneath. And hair loss drugs, well, they can come with a whole host of side effects, and the minute you stop, so do the results. You see the pattern? None of these are actually regenerating tissue. Okay, so what if we could flip the switch? What if, instead of just managing decline, we could actively regenerate? This is where the science gets really, really exciting. Turns out we can use your body's own powerful healing toolkit, concentrate it, and basically force a repair process that's gone quiet. And the key to this is a treatment called Platelet-Rich Plasma, or PRP. The idea is actually beautiful in its simplicity. We take a little bit of your own blood, spin it down to isolate and concentrate the platelets, which are little powerhouses packed with growth factors, and then we re-inject that super concentrated solution right where the damage is. We are literally using your own biology to kickstart your own healing. Now, what makes this so powerful is the sheer concentration. Your blood normally has maybe 150 to 400,000 platelets in a given area. But with therapeutic PRP, we're talking 1 to 2 million. That's a dose so high, so potent, that your body just can't create it on its own. It overwhelms the stalled out signals at the injury site and basically tells your body, hey, it's time to get to work and start rebuilding right now. And this injection triggers a very specific 3-phase healing process. First, you get a controlled inflammation phase. This is what wakes up that dormant, sleeping tissue. Then comes proliferation, where your body starts building all new infrastructure, new blood vessels, new collagen. And finally, the remodeling phase. This is where that new tissue strengthens and matures over weeks and months. This isn't a patch, it's a complete structural renovation. So, that's the science, but how does it translate into real-world solutions for the stuff that guys are actually dealing with? Let's break down 3 key ways this is being used. First up, joint pain. For things like a rotator cuff tear, tennis elbow, or knee arthritis, PRP is a potential game changer. It's an incredible alternative to surgery. And remember, PRP is anabolic. It builds tissue. The goal is to repair the damage so you can maybe avoid that major operation and the months and months of rehab that come with it. This is exactly the path that helped Michael, the pitcher we talked about earlier. Second, hair restoration. So male pattern baldness happens because hair follicles actually shrink and go dormant. It's called miniaturization. When PRP is injected into the scalp, it can actually wake those follicles up and reverse the process, leading to thicker, denser hair. And here's the best part. It does this without the potential sexual side effects that can come with drugs like finasteride. And third, sexual performance. The P-shot uses this same PRP technology to trigger the growth of new blood vessels and rejuvenate the actual erectile tissue. This is so different from pills. Pills are temporary fix. This is about addressing the root cause, the vascular health, to create more lasting, natural improvements in function. Now, I have to stop and say something really important here. A treatment this precise, this powerful, it's not something you want just anyone doing. The technology is amazing, but the results are hugely dependent on the skill of the physician holding the needle. This is why the person performing the procedure matters so much. You know, you look at a doctor in this field like Dr. Ramesh Kumar. His background is as a board-certified radiation oncologist. He trained at Harvard Medical School. He has decades of experience in the biology of how tissues work. This isn't a weekend course. He uses ultrasound to guide the needle precisely to the damaged area. This is the difference between a serious medical procedure and something you might find at a local med spa. It's night and day. So really, it all comes down to a choice. It's a fork in the road. You can keep going down the path of just managing a slow decline, or you can choose a new path toward actively regenerating your body. And that's the question you have to ask yourself. Seriously, are you willing to spend another year just putting up with it? Another year of that nagging pain, that frustration, that feeling like you're fighting a losing battle with time. Because here's the tough truth. Waiting is not a neutral act. Every single month that goes by, that cartilage is breaking down a little more, those hair follicles are shrinking, that vascular tissue is getting weaker. The problem actually gets harder to fix the longer you put it off. But you have the power to make a different choice. A choice to take back control, to work with your body's own amazing biology to rebuild what you've lost. You can choose regeneration. So if you're in the Palm Beach County or Treasure Coast area and you're ready to stop managing and start rebuilding, the first step is really simple. It's just a phone call. Here's the direct number for Dr. Kumar's team at LifeWellMD. They have offices in North Palm Beach and Port St. Lucie, so expert help is right nearby. Look, don't let another year slip by feeling stuck. Make the call. Your body hasn't forgotten how to heal. It just needs the right signal to get started again.